Hola amigos, feliz viernes, hoy es viernes, yo soy Rory y estoy contento de estar aquí contigo. Hoy estamos conversando sobre los resfríos, los resfriados y la gripe. Ahora, los resfríos y los resfriados, these are common words for cold, any kind of cold. La gripe can be the flu, but no necesariamente siempre se refiere a la influenza. So it doesn't always mean only the flu. It can also mean a cold. So people will throw around the word gripe kind of indiscriminately. Okay? Bien. So if you hear gripe, you might want to really start checking in whether you think it's cold or flu, ¿verdad? Ok, bien. Para empezar, tenemos dos verbos importantes and dos conjugaciones de uno de los verbos. So los dos verbos, tener, el verbo tener, the verb to have, it's called a stem changer. We got another name for it. I'll show you what it is in just a minute. It's the verb to have. So yo tengo, I have. Tú tienes, you have for a child. Él, ella, usted tiene, he, she, or usted have. Nosotros tenemos, we have, and then ellos, ellas, ustedes tienen. So they or y'all have. Bien. So it's a stem changer. You can see that the stem changes as we conjugate it everywhere except for nosotros. Yo doesn't have it either because it's irregular. But we also call these boot verbs. In general, everything that's in the boot is going to have a stem change when it's a stem changing verb. And you know it is because it has that little mark right there, E to IE. All right, bien. You may want to use el verbo, it's still the verb to have, but it's the tense have had, like el presente perfecto, present perfect. To do that, here we go. Like to ask the question, have you had, etc. And so have had is yo he tenido, I have had, yo he tenido. Tú has tenido, you have had to a child. Él, ella, usted, so these él, ella, and usted, ha tenido, has had, so he has had, she has had, or usted, you have had. Nosotros hemos tenido, so we have had. Y ellos, ellas, ustedes, like this, ellos, ellas, ustedes, han tenido. So they have had or y'all have had. So you'll use this in lots of questions, right? Have you had a fever? How long have you had this symptom, etc. So that's how we say have had en español. Nuestro otro verbo es el verbo sentir, sentirse, the verb to feel. Ahora, this one is a stem changer and it's reflexive. So me siento, I feel. Tú te sientes, él, ella, usted se siente. Nosotros nos sentimos. Y ellos, ellas, ustedes se sienten. Otra vez tenemos nuestra bota. We've got our boot verb here. Okay? Bien, let's take a look at some examples real quick. Unos ejemplos. ¿Cómo se siente hoy? How are you feeling today? Tengo dolor de cabeza, náusea y vómito. I've got a headache, nausea, and vomiting. ¿Qué otros síntomas tiene? What other symptoms do you have? Bueno, well, tengo tos, I've got a cough. Tengo dolor de garganta, sore throat. Y estoy fatigado, I'm fatigued. ¿Tiene fiebre? Yes, no question. ¿Tiene? Do you have? ¿Tiene fiebre? Creo que sí, I think so, porque siento calor y luego tengo escalofríos, because I feel hot and then tengo escalofríos, and then I have the chills. ¿Por cuánto tiempo ha tenido estos síntomas? See it here, ha tenido. ¿Por cuánto tiempo, for how much time, have you had these symptoms? Por unos días no más, just for a few days, no more, no más. Okay, bien. Those are some ejemplos. Let's look at some preguntas útiles and some frases comunes to help you talk through síntomas con sus pacientes. So, preguntas. ¿Qué le pasa hoy? What's the matter today? Of course, this isn't how you start. This is a question after you've gone through your introductions and you're chit-chatty with them. And then, ¿qué le pasa hoy? Well, what's the matter today? ¿Cómo se siente? How are you feeling? ¿Qué síntomas tiene? What symptoms do you have? ¿Qué otros síntomas tiene? Yes, no question format now. ¿Tiene náusea? ¿Tiene dolor? ¿Tiene vómito? Etc. Siente, same thing. ¿Siente náusea? ¿Siente dolor? ¿Siente whatever it might be? ¿Sí? ¿Por cuánto tiempo ha tenido? For how long have you had? Ha tenido. There's our ha tenido again. ¿Cuándo empezó? When did it start? ¿Cuándo empezó? ¿Cuándo siente? When do you feel? ¿Cuándo siente dolor? When do you feel pain? Todo el día, etc. Frases, frases. So, antes de, before, antes de, después de, after, de repente, suddenly, a veces, sometimes, siempre, always, nunca, never, poco, a little, mucho, a lot, me duele, it hurts me, so me duele, fill in the blank with any body part at the end. Me duele la cabeza, me duele la garganta, me duele el pecho, etc. Me pica, Me pica, something itches or stings, okay? Me pican los ojos. Me pica el oído, etc. Me arde, something burns. Me arde el pecho, my chest burns. Or me arde la garganta, my throat burns. Or me arden los ojos, etc. Me cuesta, me cuesta, me cuesta. Something's difficult for me. It like costs me a lot of effort. Think of it that way. Me cuesta respirar. It's like saying I have difficulty breathing, right? Me cuesta caminar. It's hard to walk, etc. So add any verbo ahí. All right, bien. Signos y síntomas básicos that are relevant to our common cold and flu. En la cabeza tenemos congestión o nariz tapada, so congestion and stuffy nose. Estornudo, sneezing. Goteo nasal, like a runny nose. Y mareos, like dizziness. En el pecho, falta de aire, shortness of breath. Palpitaciones, so palpitations. Silbidos, so like a wheezing, ¿verdad? Tos, cough. Tos persistente, a persistent cough. Tos seca, a dry cough. Tos con flema, like a productive or cough with phlegm. En el cuerpo, síntomas. Cólicos, or cramping, like abdominal cramps, feminine cramps too, cólicos. Diarrhea con sangre, bloody diarrhea, or diarrhea with blood. Entumecimiento y hormigueo. I'm so sorry, these are long and nasty and hard to say, but that's how you say numbness and tingling, and there's no way around it. Entumecimiento, numbness, hormigueo, tingling. All right, estreñimiento, constipation. Fatiga y sueño. Fatigue, sueño, tiredness, sleepiness, etc. Gas is usually fine, but if you had to specify, gas abdominal, like abdominal gas. Hinchazón, swelling. Inflamación, inflammation. Fiebre y sudores. So fiebre, fever. Sudores, sweats or sweating. Sudores nocturnos, night sweats. Náuseas y vómitos. So nausea and vomiting. See? Temblores, shaking. Okay? En la piel, so now on the skin. En la piel, enrojecimiento, another long one, or rojez, lo siento, really common, redness. Okay? Irritación y erupción, so any kind of general rash, irritación or erupción. Moretones, magulladuras, these are bruises. Okay? Picazón o comezón, this is kind of any kind of itching, basically. Salpullido y ronchas. Now, this is more like bumpy rashes, hivey rashes, etc. Okay, so we've got our signos y síntomas básicos. Now let's look at unos signos y síntomas más, a few more. Okay, so cambios en, if you ever want to talk about changes in something. Cambios en apetito, changes in your appetite. Cambios en color, changes in color. Cambios en peso, cambios, changes in your weight. Cambios en visión, changes in your vision. Now, you could change that and make it cambios de also. Cambios en, cambios de means the same thing. Okay? Bien. Dificultad para is difficulty doing something. So, dificultad para caminar, difficulty walking. Dificultad para dormir or dormirse. What's the difference? Dormir, el verbo on its own is sleep. Dormirse, falling asleep. So, dificultad para dormirse. ¿Tiene dificultad para dormirse? Do you have difficulty falling asleep? ¿Tiene dificultad para dormir? Do you have difficulty sleeping? Básicamente. Okay? Respirar, to breathe. Orinar, to urinate. Tragar, to swallow. Dolor de. Tiene dolor de cabeza, headache. Dolor de estómago, stomachache. Dolor de garganta, sore throat. Dolor de oídos, earache. Okay? Bien. Now, dolor de works really well for all of those common aches and pains. But for other random pains, we probably wouldn't use dolor de. We use the expression me duele. Have you heard it? Me duele la nariz. A nose ache isn't really one of those common aches and pains, but me duele la nariz, so my nose hurts. Me duelen los dientes. Or tengo dolor de dientes also. That's a common, toothache is a common one. Okay, dolor al is pain doing an action. Dolor al orinar is pain with urination, basically. Dolor al mover, and you could add a body part there. So pain with moving a particular body part. Toser, dolor al toser, pain with cough. Pérdida de, loss of something. Pérdida de apetito, loss of appetite. Now here we had cambios en apetito, great, changes in appetite, but now we're talking pérdida de apetito, loss of appetite. Pérdida de audición, loss of hearing. Pérdida de gusto, loss of taste. Pérdida de olfato, loss of smell. Okay, bien. All right, so you've got a bunch of questions that you can put together with some of these symptoms and get a good sense for where people are at with their presenting problem, right? If it's cold and flu. So now what? Unas frases de transición. So now we kind of understand what's going on. Unas frases de transición. I need to. Necesito examinarle. I need to examine on you, or mirarle, look, or escucharle, listen, and then any parte del cuerpo. For example, necesito examinarle el abdomen. I need to examine your abdomen. Necesito mirarle la garganta. I need to look at your throat. Necesito escucharle los pulmones. I need to listen to your lungs. Okay? Bien. Or necesito tomarle whatever signo vital. Tomarle la temperatura. Tomarle el pulso. Tomarle la presión, etc. Favor de, please do this. Favor de acostarse. Please lie down. Favor de respirar profundo. O respirar normal. Favor de esperar aquí. Please wait here. Favor de quitarse la ropa. Take off your clothes, or quitarse la camisa, los pantalones, whatever it might be. Okay? Usted necesita, you need. Usted necesita tomar or usar whatever tratamiento we're talking about. Usted necesita tomar antibióticos. Usted necesita usar una crema o una compresa caliente, a hot pack, or compresa fría, a cold pack. Usted necesita descansar. You need to rest. Usted necesita aislarse. You need to isolate. Usted necesita hacerse la prueba de COVID. Woohoo. Okay, you need to get your COVID test. See? All right. Usted puede. You can. Usted puede tomar whatever medicamento we're talking about para whatever síntoma it's meant for. For example, usted puede tomar el acetaminofén para la fiebre. Okay? Alternar. Ok, usted puede alternar entre el acetaminofén y el ibuprofeno. And we can say para el dolor, maybe. Okay. I'm going to, here's what I'm going to do now. Voy a hablar con, I'm going to speak with somebody, ¿sí? Voy a pedir, I'm going to order. Voy a pedir whatever prueba, análisis, or imagen, maybe, ¿sí? And voy a recetarle. I'm going to prescribe to you un medicamento. All right, para conversar con su compañero. I've got a couple of situations here that with your conversation partner, you could work these out, practice some of this vocabulario together. Paciente 1. Julia tiene 15 años, es muy activa y muy saludable. Hoy se siente muy cansada. Today she's feeling really tired. Tiene congestión y una tos nueva. She's got congestion and a new cough. Okay, that's Julia. Paciente número 2. Pablo tiene 10 años. Pablo's 10. Tiene dolor de garganta. Tiene fiebre y mucha congestión y escalofríos por 3 días. Por un día le duelen los 2 oídos también. And for one day he's got an earache also. Paciente 3. Susana es una maestra de primaria y tiene 52 años. So she's a primary school teacher, elementary school teacher. Está al día con sus vacunas, COVID and gripe. So she's up to date with her vaccines. Pero padece diabetes tipo 2. But she has diabetes, type 2 diabetes, y presión alta and high blood pressure. Por un día ha tenido fiebre. For one day she's had a fever, una tos nueva, a new cough, y no tiene apetito. Okay, so you've got 3 patients here. Here's what I want you to do with your conversation partner. You want to introduce yourself as whatever your position and role is, right? Talk through their symptoms, and then see if you can suggest some next steps for them. So 3 things. Introduce yourself, talk through their symptoms, suggest some next steps. ¿Alguna pregunta? Post them below in the comment section, and we can respond to your questions, okay? And if you need a conversation partner, head over to the Learning Medical Spanish Facebook group, and there you can put yourself out there and say, hey, I'm Rory, I'm an intermediate speaker, I'm looking for a conversation partner to do video viernes stuff with. Can anyone partner up with me? All right? Muy bien. Gracias por aprender español conmigo. Juntos realmente mejoramos comunidades. Para más español, head over to commongroundinternational.com. Y para tomar un examen de español, una terminología, head over to certifiedspanish.com, and you can take as many free terminology tests as you want. All right? Hey, amigos, if you like the video, make sure you go ahead and like it. If you learned something new, make sure you subscribe to our channel so that you can keep getting new videos every week. Ciao, amigos. Hasta la próxima semana.